I'd like to introduce Julia Schopick, author of Honest Medicine from the United States. Welcome, Julia.
Hi, Linda. It's so good to be with you today.
Thank you. Could you tell us how you got involved in LDN?
Well, it actually started many years ago when my husband was a brain tumor patient and his tumor had recurred. So that must have been around 2001. A wonderful friend of mine named Dennis Roth, whose son had a malignant brain tumor just like my husband, called me and said, "I've just learned about the most wonderful man, Dr. Bernard Bahari, and he has a wonderful treatment that is terrific for cancer." And he said, "I've spoken with him. Please set up a time to speak with him yourself." So I did. And I was so impressed with Dr. Bahari that my husband did start taking LDN. And unfortunately, when he was in the hospital, which was several times, for seizures and all of that, the LDN was taken away. And so we had to stop, start. So that wasn't very successful. But I found out about LDN, and I just kept reading, and I was so impressed. After my husband died, it's in my book all about how I found that inexpensive treatments worked while some very expensive ones didn't. We had a situation where my husband's skin wouldn't heal, and through a doctor friend, I found the treatment that did work for him. It was called Silverlawn, and the doctors just weren't interested. They wanted to believe it was their own antibiotics that had made his skin heal. So I knew that something was desperately wrong with our medical system, and I said, I've got to expose this, that inexpensive treatments are being ignored at the expense, in favor of expensive, ineffective treatments. And guess what? I started thinking back to the treatments I had learned about when Tim was sick, one of them being LDN. So that's how I found out about LDN. I then wrote an article for my blog, honestmedicine.com, about 4 treatments that are effective, time-tested, etc., but the doctors really don't like as much as the expensive, ineffective treatments. And LDN was kind of one of the stars of that article, which then turned into my book.
How many people would you estimate around the world are probably taking LDN?
It's very difficult to know, but I always say tens of thousands. And the reason I say that is that LDN has so many, I have never seen a treatment that has so many advocates, physicians and patients alike, out there. There were so many advocates that I could only mention a few. You, Sammy Jo Wilkinson, Vicki Finlayson, but I was nervous about mentioning everybody because I knew I'd miss some. So I would say, and I'm confident in saying, there are hundreds and hundreds of advocates, which makes me really believe there are tens of thousands of people who are taking it.
Yes, certainly the word is spreading for the unusual autoimmune diseases, and in far-fetched countries as well, countries that up until now haven't necessarily heard that much about LDN.
It's spreading like wildfire, and I'm just so impressed with LDN. As you know, there's a new Facebook group that is called Got Endorphins, LDN, and it just started, spreading like wildfire. I was watching, at first there were 3 of us there, and then there were 100. People want to tell their story. And I'm hoping that as people tell their stories, and as my book gets read all around the world, hopefully, people will start telling their doctors, no, I don't want to take these crab drugs, which I'm sure you've mentioned before on this DVD, the expensive injectables that don't seem to work for people, and they have so many side effects. I hope people will start demanding, okay, doctor, I'm going to be leaving if you won't at least read about this low-dose naltrexone. Because so many people in my book tell about how their doctors just wouldn't even want to learn about it. And, as we all know, you do need a prescription, which is the bad part, because they have to go, and not feeling well, to have to go hunting for a doctor is very difficult.
Thank you very much for taking part, Julia.
Thank you.